look at the Affordable Care Act, and I'm not necessarily pro-Affordable Care Act, I'm pro some program or series of programs that gets every human being the health care that I believe every human being deserves. When I look at the criticism of the Affordable Care Act and the places that haven't expanded Medicaid in the Affordable Care Act, those were the states that weren't doing very well for health care to begin with.
Mm-hmm.
You know, those are, interestingly, they're frequently also the red states as well. That's an interesting conversation as well. Why is it that the states where people seem not to care as much about each other tend to be overwhelmingly Republican? That's an interesting question.
Okay, thank you.
I'm an academic, I can go there.
Yes, you can. Peter, did you care to react or ask any other questions?
Yeah, so where are you on Medicare for All and the ACA? You know, I think the Biden campaign has staked out a position of some sort of public option, but given that coverage is not distributed equally and contributes to disparity and inequity, I'm curious what you see as the sort of the coverage solution. Are you in favor of Medicare for all?
Well, I'm not necessarily in favor of Medicare for all. I'm not opposed to Medicare for all. What I'm in favor of is all people having access to health care. And going beyond that, you know, giving them insurance is not enough. We need to also have programs that help them utilize that insurance. Now, if someone were to come up with another program that allowed all people to have access to adequate care, I would support that. My problem with those who criticize the Affordable Care Act is they criticize the Affordable Care Act, but they don't propose something that would reach my goal of giving every human being the care that every human being ought to get. If they come up with a better program or an alternative program, I'm very open to that. Now, I'll also tell you, every big social program that has ever been implemented, Social Security, Medicare, has been tweaked and changed virtually every year since it was implemented. For Social Security, it was implemented in the 1930s, and the program has had some kind of change every year since the mid-1930s. Medicare every year since 1964. The Affordable Care Act was instituted a little over 10 years ago now, and it hasn't had the opportunity to be tweaked and changed and modified because one party keeps saying no. Is the Affordable Care Act perfect? Absolutely not. It's better than almost anything that I've seen so far. By the way, there are a number of studies out there that demonstrate that people are not dying because of the Affordable Care Act. There are a number of studies out there that are demonstrating that people are not suffering because of the Affordable Care Act. By the same token, there are studies out there that indicate that there's more death and more suffering in states that have not expanded Medicaid under the Affordable Care Act versus states that have. All those studies are out there. If people care about their fellow human beings, now I'll go so far as if they espouse to be a Christian, as many do, we need to have programs to help our fellow man.
So if I'm understanding you correctly, you're sort of, religious terms are being bandied about here, but you're sort of agnostic as to the means by which we get to universal coverage and access. But you're in favor of the end.
Yeah.
And of the things that are out there, the ACA is serving that end pretty darn well.
It is serving it well, but it's not perfect. I readily admit that it is not perfect legislation.
Yeah.
Interestingly, by the way, when the Affordable Care Act was implemented, it had already been tested. The Affordable Care Act is almost a plagiarism of what was known as Romney Care, which Mitt Romney implemented in Massachusetts. Interestingly, Romney Care was an invention of the Heritage Foundation, which is a very conservative think tank. And so, it's actually, yes, the Democrats plagiarized the Republicans in the Affordable Care Act. That is absolutely true.
Yeah, I mean, at many levels, the ACA is profoundly conservative. You know, you're using private insurers, and I think the individual mandate, which is no longer, was part of the original Heritage Foundation conception of you know, mandating coverage and increasing the risk pool.